Another two panelists up to the stage to talk about their experiences and their work. First of all, Linda Pfeiffer, who's the president of INMED, and Jeff Griffiths, who is the director of Tufts Nutrition Innovation Lab for Africa. Welcome to the stage.
Thank you.
In the health of women and children in these hotspot countries particularly, but also elsewhere. Linda, come to you first.
Well, climate change is of course bringing, we've seen it on the news, extended periods of drought, and especially in these regions as well as around the world, and often these are coupled by devastating periods of rainfall. And that combined with things like man-made deforestation make it increasingly difficult for women and families and smallhold farmers to produce and access healthy foods. And also these devastating rainfalls, especially in rural areas, wash out the roads, making it impossible for women to reach the health centers, as we've heard. These kinds of conditions are prevalent in these hotspot countries, but as you mentioned, also in micro hotspots around the world within different countries. For example, in the Peruvian Amazon rainforest, where INMED is working with indigenous groups like the Shipibo, Canibo people, Ashinaka, and others. And there the infant mortality is more than 50 per thousand, and young child deaths, younger than 5 years old, is 64 per thousand. So climate change is affecting both these macro hotspots and micro hotspots around the world.
Jeff.
Well, it's very interesting, you know, when you think about climate change, we think about the dramatic events, just as you were talking about. We also need to focus on sort of the slow, small-scale changes that happen over time. We're seeing things like more diseases being more prevalent, like malaria in places where they had not. Nairobi used to be free of malaria. It has now got malaria in a way that it didn't used to. Some of you may not know that over 80 degrees Fahrenheit, tomato growth goes down. And that's true for many plants. So that as things both get warmer and drier, we're seeing a lot of problems with crop productivity. And of course, big issues that happen to deal with maternal and child survival are related to nutrition. And as things change, things are going to become more challenging. People are also going to try and do things like dam up reservoirs and stuff like that so there's more water. That comes with a certain cost sometimes, with certain waterborne diseases and water and sanitation and things like that, and malaria, for example.
So Jeff, could you say a little bit more about the work that you do at Tufts and some of the research and learnings that you've seen in terms of the environmental sort of impact on health?
Well, we're looking at things that have to do with connecting nutrition with agriculture. And many of you may say, oh, it's obvious, you know, you just grow more food and then there's more food and everything is better in terms of nutrition. It turns out if you grow more food, income goes up for poor farmers, but nutrition may not get better. There's a lot of other things that are involved. For example, people may sell off the food so they can afford school fees for their children or improve their house. It may also be that there are other things that prevent more food from actually helping you. We've heard a lot about water and sanitation. A lot of people live with sort of a chronic illness of their intestine called enteropathy. And you can feed people a lot of food and it won't make much difference sometimes if they have that sort of a circumstance. And one of the things that's interesting about climate change is that we're seeing more of this mold that's growing in food called aflatoxin. And that also affects growth. It's against the law to feed any crop to animals in the United States or Europe that has aflatoxin. And yet when you look all around the world and you look at the humid tropics, they have terribly high levels of aflatoxins in their foods. So we're talking about food safety as well as the other things that we've just mentioned.
So what can be done to address this issue? I mean, surely everyone knows that that more food doesn't necessarily mean good nutrition.
Well, it means we have to break down the barriers between things. People talked about, someone was just complaining to me, I've heard nothing except nutrition and toilets. Well, we have to break down those barriers between those. We have to be able to go ahead and say, you know what, these are really connected. And things like food safety that has to do with having to eat moldy food, well, that has to do with growth of a child inside the pregnant woman. It has to do with how that baby is going to grow. Turns out these aflatoxins even make their way through breast milk. So you can promote breast milk, but you may also be at the same time having a toxin going its way through it. So part of it is to understand the science and then to come up with interventions which are cost effective to be able to deal with these things.
Linda, one of the values of INMED is to address sort of cross-cutting health and social factors that influence each stage of life. So clearly you've thought about the linking between sort of health and social determinants of health. So what do you think the most difficult challenge has been, and where and what makes sort of this cross-cutting social factors and health work?
Well, I think everyone here is in agreement that single interventions just simply aren't enough. And there really are two, I think, extremely key factor to addressing maternal and health outcomes. And one, of course, is empowering women for economic development that we've heard about, and the other is stabilizing families. And the migration of women and men from rural areas to urban areas it fractures families. And the result is often the spread of epidemics that are caused by overcrowding or unsanitary conditions in the urban areas, which then are brought back to the rural areas, and epidemics are spread. AIDS, of course, is an example we all know about. So providing rural families the ability to produce their own food and to make a living on their land by selling the excess produce is really essential. And of course, climate change challenges that. And INMED has been working and is implementing adaptive agriculture programs in many countries, and there are specific interventions. One in particular is a low-cost, simplified form of aquaponics, which is a combination of fish production and soilless crop production in a closed system. So it utilizes 85 to 90% less water than traditional agriculture, and it's very intensive. So it produces up to 88 times the yield in the same space as traditional agriculture. At least that's the most that we've gotten out of it so far. And it's less physically taxing. So this is important for pregnant women. And it also produces balanced, nutritious food that's important for pregnancy, fetal development, breastfeeding. And we're implementing this currently in 20 communities in Latin America, and the Caribbean, and Southern Africa. And solutions like this, as you asked about challenges, I think the most difficult thing is behavior change. We talked about a lot of innovations here. Behavior change, adapting to something new. But we found for these new technologies, actually the women in the program seem to embrace them more quickly and put them to use for the benefit of their families.
I mean, behaviour change is such an important issue, and also allowing things to grow organically on the ground, so that this is not somebody's sort of a top-down approach. Jeff, I know when we were sort of talking earlier, you were talking about some of the research you were doing in Uganda, and how areas of the country which do phenomenally well in terms of growing crops, a lot of children are still very sort of malnourished. How do we change that behaviour so that we're not selling off the good bits?
Well, so what you're talking about is people who produce more, but then the benefits of the growing more don't go within the family. It's sold off for those kinds of things. So I think that this is education. This is discourse around what are the benefits of nutrition. It's concrete examples of seeing what happens when there are maybe other families in the same communities who practice some of these things, and you can see that their children are larger and healthier. So behavior change is got to be contextualized for the place where you are in terms of what the reasoning is. But we're seeing areas in Uganda where productivity is very high, but children are simply getting mush porridge. They're just getting maize porridge and they don't get anything else. I was reminded about climate change in Malawi and overfishing, for example, just after the last speaker, because, for example, there used to be a lot of small fish that were caught in Lake Malawi, and they used to be sprinkled onto what the small children would get as part of their food, and it provided an important source of animal source protein for them. And all the fishery is gone. And, you know, is that human? How much of that is climate change? And where do we see where those things are going to go? The things that you were just talking about, in fact, address some of those in terms of having a different source of food. So there's both income and something that's helpful for nutrition and can be made sensible to people. People are smart. Farmers are smart people. They just need to understand their circumstances sometimes a little bit more.
So obviously there's behaviour change on the ground. How do we change the behaviour of governments and ministers that maybe have a certain idea of doing things, or the donors who have a certain idea of doing things? And I'm thinking in my head of the G8, the New Alliance initiative particularly, which is to promote good nutrition.
Give them evidence. God bless us, we have to come up with evidence about what works. We have to know not just what's the coolest thing somebody can talk about, but actually what really works. We actually have to do research, bad word, to actually find out what makes a difference and actually pay attention to it. Everybody's assumed that more food meant better nutrition. Turns out it's not true. It means more income, but it doesn't mean more nutrition. So we have to pay attention to what we're doing, and we have to actually track this kind of stuff. I mean, in 10 years, I hope that that's what my work is. That's the benefit of it, is that policymakers have something concrete that they can grab hold of.
And what's the role of maybe agribusiness in this, in addressing these kind of issues? Is there a role?
Well, there's a tremendous role for agribusiness. I think that agribusiness wants to be seen not only as a way of making money and of providing more food for people, but also making them healthier. You want to provide economically sustainable ways of doing things. And, you know, whenever people talk about sustainability, I usually think that means a good business model. So I think agribusiness has an important part to play. But if agribusiness says it's only more corn yield and doesn't think about the other stuff that goes along with that, then people will just be eating more corn. And it doesn't mean that they're going to be healthier. So you have to think about what's the social responsibility of the agencies too.
Great, thank you. And Linda, back to you, just looking to the future, looking ahead, what are your plans, INMED's plans, and how do we address these kind of issues in the next set of development goals, for example?
Well, first of all, any kind of innovations that we bring to tackle these solutions, especially in the resource-limited context that we're talking about, they need to be low cost, utilizing locally available materials, and adaptable to the local space and climate constraints that are there. And there's all kinds of exciting things that are happening now, and some of these innovations in agriculture that really bridge the health and the agriculture worlds are being discussed in many places. There's a symposium coming up in June of 2015, a Harvest the Future symposium, where a lot of these innovations are going to be discussed, including aquaponics, but lots of other ones. And we're involved with that with USAID, FAO, IDB, and others. And it's so important for not only addressing not only the current Millennium Development Goals, but for helping to advise the post-2015 agenda that's being put together right now. And in the report that came out from the eminent committee that's making recommendations to shape the post-2015 agenda, at the very end there's a paragraph and it said, but all of these recommendations are for naught if we don't address climate change.
Interesting, thank you. Jeff, final thoughts, future. Where should we be directing resources, energies?
Well, I've already said that we've got to pay attention to what we're doing. I also think we have to pay attention to when people break down barriers between different kinds of thinking and different kinds of things, because that's where a lot of the juice is in life. When we find out, you know, not just single solutions being done together, but, you know, what's being done by policymakers now is they're implementing multiple things at the same time. Well, we may get synergy out of it. We may get extra bang for the buck by that. happening. So we have to pay attention not just to programs that are set like this. We have to think about when we can find out about the stuff that bleeds off to the edges and actually provides some incremental benefit. And I think that a lot of the efforts that are those that are the ones that have to do with water or with sustainability or drought management and things like that, that's where some of these benefits are going to be found, especially as they relate to climate.
Great. Thank you very much. I'd like to thank Linda Pfeiffer and Jeff Griffiths. Thank you very much.
Thank you.
Thank you.